Thank you very much. As you know, Colombia had one of the typical safety crises in 2014. There were rumors generated by a large number of presumptive cases of secondary health effects. It was a major collective panic response in the population of Carmen of Bolivar, and there was a limited political reaction among the health leaders. And that generated a severe reduction in the vaccine acceptance and promotion. You can see here 2014, and you see a significant drop from 88% in 2012 for girls receiving a full regime to a testimonial 5% in 2016. We calculated that for the girls of the cohort of 2003 with an 88% coverage with the full course, there were 4,300 cases and close to 2,000 deaths avoided over lifetime. And in comparison for the cohort born in 2007, the coverage was very, very low, and the number of cases prevented was merely 220 cases. This is a significant event that we've seen in a number of countries in the world. So the name of the game for HPV is persistency, and it is important to reinforce the idea that we have to be always there and acting to promote HPV vaccination. Some of the activities that were undertaken in Colombia, first one was the creation of a local task force chaired by Dr. Castro, and he'll elaborate on this one. There was a number of visits and consultations, including a meeting of experts by the HPV Prevention and Control Board in 2018. And after that, we continue specific collaborations with these groups from the ICO in two activities. One is the creation of an e-learning program on vaccine safety, and the other one is the dissemination of the newsletter as well. The e-learning program at the Català Institute of Oncology joined forces with the Instituto Nacional de Cancerología in Bogotá and had the support of the recently created unit of distant learning in Bogotá by the Open University of Catalonia. Next one. We generated a course on HPV vaccine safety, and that included a number of speakers from the e-oncology program and a number of speakers from the National Institute in Colombia. We had an estimate on the burden of disease created by HPV in Latin America that was all customized to the population in Latin America. Was a couple of presentations on efficacy and effectiveness, two presentations on vaccine safety, and a specific discussion on the episode of Carmen de Bolivar and the acceptability of the vaccine in this particular population. The course was open in July 19, 2018, and up to now, there were 10,000 students that registered for the educational program. That supports the concept that we all understand that the role of the healthcare provider is essential in creating confidence in the vaccination program. About half of these 10,000 were Colombian, and about half were from other countries in Latin America. That is a significant effect because when you generate an educational material of high quality in Spanish language, that spills over not only to the country of the target country, but also to the neighbors. Currently, there are 8,000 students completing the educational program. About 4,000 already passed. That's a 52% compliance and completion of the course, which is very high for an open access course in the e-learning mode. The profile of the first 5,000 participants includes medical doctors, nurses, and other profiles, including a very high participation of medical students. That is part of the objective, and there were specific activities targeting the societies that are directly or indirectly involved in vaccination and HPV vaccination. At the end of the course, the participant received a certificate which in some areas qualifies you for continuous medical education credits. In some other areas, it just represents an educational activity conducted under the auspices of the National Cancer Institute in Colombia. Next one. The second activity that we conducted from the outside was the preparation of HPV Bull entries, both in Spanish and in English. And this is a project, if you can go to the next one, that has been going on since 2018. These are the metrics of the use. It essentially accommodates to the ability today of circulating high quality information in a very concise and to the point pieces of information. And this circulates through the e-learning, through the social media networks, and a number of other direct person-to-person communication in an easy way from your phone, your computer, or your tablet. Just to give you an example, we now have about 160 published contributions in the website. These contributions are generating in 2020 close to 800,000 impressions and 500,000 Google impressions, indicating that anyone in the world searching on HPV had find the page and entered the page for additional information. In this particular case, there was this entry in Spanish language. First was an English one, and then it was in Spanish one, run by Carlos Castro and Nubia Muñoz, who were our leaders in this particular field. And that particular piece of information, again, generated a very large number of communication, interpersonal communications within and without and outside Colombia. One of the characteristics of this newsletter is that it has these particular posts that are circulated largely in the social media, and it just generates the key messages of the contribution that runs in the phones, and this particular phone communication can then be recirculated very easily. So, for example, this particular one generated 2,500 new persons reached in the month following the first publication. And this newsletter is now running widely in the world. You see that in Colombia there were 364 subscribers. These are persons that signed for receiving the piece of information regularly on their materials. Very large contribution in the United States and in the neighboring countries in Latin America. So these external efforts represent the definite will to continue the impact of the meeting that we held in Colombia, supporting the local investigators and the local public health officials from the outside, and in a way that is easily applicable to any other country suffering from similar vaccine crisis impacts. And I'm now handing it to Dr. Castro, who will tell you a little bit on the impact of these efforts in the local acceptability of the vaccine.